Hi, my name is Lacey, and I'd like to walk you through my business proposal for an all-inclusive sports medicine facility, Diamond Bone and Joint. Oftentimes, when a sports-related injury occurs, there's many steps that need to be followed in order to recover from that injury. You may need to go see a doctor, get some sort of imaging like an X-ray or an MRI, possibly have surgery. You may need to follow a course of rehab, and of course, there's the never-ending insurance paperwork. All of this can be overwhelming. It can cause one to change their lifestyle. It could impact their health, both mentally and physically, and it can cause economic loss. The goal of this clinic is to remove the burden caused by suffering an athletically related injury and to provide a comprehensive opportunity to benefit from all necessary services to help in the recovery process and guide the patient from diagnosis to treatment to rehabilitation to return to activity all under one roof. DBJ is dedicated to creating an environment that allows the patient who has suffered from a sports-related injury or a biomechanical defect that can be corrected to be guided from injury to recovery to enhance performance in sport following a protocol of comprehensive care. Diamond Bone and Joint will be a Northern California-based company who will provide medical services for athletically related injuries. It will have both general care practitioners as well as orthopedic surgeons. The general care practitioners are responsible for the management of non-surgical sports-related injuries and acting as a filter for the orthopedic surgeons. The orthopedic surgeons are responsible for sports-related injuries that require surgical intervention. They will perform surgeries and will provide the post-surgical protocol for recovery. DBJ Imaging will perform X-rays, MRIs, and CTs at the request of the ordering physician. The radiology techs may also be called upon to aid in performing ultrasounds for guided injections performed by the physicians. DBJ Physical Therapy will offer both physical therapists and athletic trainers to help with the rehabilitation portion of the recovery process. The athletic trainers may also perform outreach to local high schools for coverage of contact sports and providing acute care during the week. Nutrition is an integral part of recovery from injury. A sports nutritionist can help to promote healing, but can also aid in properly fueling the body for optimal performance. A sports psychologist can help the patient understand their injury and reconcile the emotions that go along with it. Sports performance will bridge the gap between injury to recovery. Sports medicine is a relatively new field that was once thought to be a luxury service for elite athletes, but it has gained public acceptance and has become more accessible to most Americans. During the next 5 years, increased promotion and government support for sports participation, as well as healthcare reform provisions and technological advancements, will drive growth within this industry. As society continues to raise concerns over high obesity rates in children, this will bolster participation in sporting events that will subsequently increase demand for sports medicine services as more people will be at risk for injury. The medical field is an ever-expanding field that will continue to grow with the population and is currently a $37 billion industry. People age 18 to 64, the target market for DBJ, currently make up 53.5% of the demographic. Driving forces behind the success of this industry are the number of people with private health insurance, federal funding for Medicare or Medicaid, the per capita disposable income, and the regulations imposed upon doctors. Competition in this industry is principally based on reputation, price, accessibility, and quality. The concentration of specialized doctors in this industry is low, as the industry is highly fragmented. The physical therapy industry has benefited from the growing awareness of rehabilitation and its ability to lower healthcare costs. The barriers to entry are low and remain steady. It is cost-effective to open a clinic from scratch, and you usually see profitability within 6 to 12 months. Barriers remain low due to the patient's ability to choose an alternate provider in the same service area. The driving forces of this industry are the median age of the population, the number of employees, the number of people with private health insurance, and the per capita disposable income. In light of mounting demand from the aging population and healthcare reform provisions, the shortage of physical therapists is likely to intensify in the next 5 years. Sacramento is the capital of the third largest state in the United States, and as of 2013 had a population of almost 500,000 people. It is home to an international airport, several professional and semi-professional sports teams, as well as home to several colleges and universities that have sports programs. Sacramento is known for the abundance of recreational sporting opportunities within the area. This makes Sacramento or one of its surrounding communities the perfect place for this clinic. The specific demographics of this target market are too broad to list or completely define. By providing a healthcare service, we are targeting people with a variety of occupations, educational backgrounds, personalities, and lifestyles. The customers of DBJ will be males and females ranging from 14 to 65 years of age who lead an active lifestyle. They will be members of a recreational league, part of a semi-professional or professional sports team, or may be considered weekend warriors. They are also potentially members of a college or university sports team, or even a little league. A majority of the potential market will have a private health insurance and will have some disposable income to fund participation in these activities. They will also be physically active anywhere from 2 to 7 days a week. The competition for DBJ is relatively low, as there are not other clinics of this caliber in the Sacramento area. There are multiple physical therapy clinics as well as orthopedic clinics, but we have a competitive advantage of providing comprehensive care in one location, providing convenience to the customer. DBJ will also have the advantage of specializing in sports-related injuries, allowing us to focus on an active population as opposed to geriatric patients or workers' compensation. Diamond Bone & Joint does have competitors outside the Sacramento area that use the same model as described by DBJ. They include the Kerlan-Jobe Orthopedic Clinic, who has 2 locations, one in Los Angeles and one in Anaheim, California. The Kerlan-Jobe facilities are the model for DBJ, but DBJ will have a more streamlined approach to patient care. The Kerlan-Jobe facility includes operating suites, exam rooms, radiology facilities, and access to a physical therapy clinic all within one building. I have worked firsthand with Kerlan-Jobe, and the biggest problem I have seen with their business is patient care. There is generally a long wait time to schedule an appointment, the physical therapy clinic doesn't always communicate well with the physicians, and once a person's medical insurance is entered into the system, other departments of Kerlan-Jobe don't always have access to that information. Another competitor is the Kaiser Sports Medicine Clinic. It houses both physical therapists and orthopedic surgeons in one central facility. Kaiser Permanente is known for their one-stop shop that they provide to their patients. The downside is they only serve those with Kaiser Permanente health insurance. This eliminates a great portion of the potential market. Lastly, the Steadman Hawkins Orthopedic Clinic also has 2 locations, one in Denver, Colorado, and one in Greenville, South Carolina. Again, this facility has X-ray capability and is connected to a physical therapy clinic, but unlike Kerlan-Jobe, it is connected to a hospital. All of the surgeries and imaging other than X-rays are done at the hospital. Steadman Hawkins has great notoriety in the sports medicine world, and that is something that DBJ hopes to achieve. The future CEO will have both a business background and experience within the healthcare industry. The Vice President of Marketing will have the responsibilities of building and maintaining relationships with our customers and within the community. They will be responsible for initiating relationships with other providers in the community, as well as maintaining relationships with key partners and providers of ancillary services. The Vice President of IT will oversee the integration of the electronic medical record system that DBJ will use to communicate and maintain global patient records. They will also be in charge of the website and maintaining a portal that can be used by the patients to make appointments and obtain copies of medical records. The management style of Diamond Bone & Joint can be described as consultative. The communication is from the top down, but feedback to management is encouraged to maintain morale and help those making decisions understand the implications of those decisions. The founder will oversee the CEO, the Vice President of Marketing, and the Vice President of Information Technology. Each of them will oversee different divisions and have different responsibilities. It is the goal of Diamond Bone & Joint to become known as the premier orthopedic clinic for sports-related injuries. We will strive to be known nationally for our cutting-edge technology and techniques and providing comprehensive care to our patients in one facility. We will do our best to draw the best surgeons, athletic trainers, and physical therapists, and other practitioners to serve the community of Sacramento, California. We want to start with the best to draw in the best. Not only is it important for our practitioners to be the best at what they do, but it's also important for our clients to be elite athletes whose treatment and recovery will get national attention. The income statement shows that Diamond Bone & Joint will be making a profit in the first month of operation and will continue to make a profit throughout the year. Because we are offering a service that is mostly guaranteed payment by insurance companies, we are confident that the inability to pay will not greatly affect our bottom line. The income statement also shows that we expect to see a 1% increase in revenue a month starting after 6 months. In a breakdown of revenues generated, we know that orthopedic surgery accounts for 69% of DBJ's income. The orthopedic clinic generates 16%, while physical therapy and imaging generate 4% and 12% respectively. With that said, we noted that in order to break even, one of our orthopedic surgeons will need to see 12 to 13 patients a day in the clinic, while the other orthopedic surgeon will need to perform 5 to 6 surgeries during their operating rotation. Each surgeon will be in the clinic 3 days a week and will alternate in the OR 2 days a week. Each of the physical therapists will need to see 11 patients a day, and imaging will need to see 8 people a day. The industry standard shows that orthopedic surgeons generally see more than 13 patients in a day during clinic hours. Surgeries are generally 6 in a day, but it depends on the surgery and the extent of the procedure. Physical therapists, along with athletic trainers, are able to see more than 11 patients in a day. The total number is probably closer to 15 to 18. The underestimation for the break-even analysis allows a little wiggle room for growth if other areas are not meeting their full potential, but it does not force us to increase our staff. After 5 to 7 years of growing the reputation of Diamond Bone & Joint, and establishing ourselves within the community, DBJ will consider being acquired by a local hospital where we can use their resources and continue to branch out into a research-based facility that will allow us to better understand sports-related injuries and better serve the community. Diamond Bone & Joint is seeking an investment of $1 million in venture capital to help start the all-inclusive sports medicine facility. DBJ has a net present value of over $2 million, and with a $1 million investment, Diamond Bone & Joint is offering a 47% ownership with a projected 5-year term. We expect a total net profit of $25.6 million over the next 5 years. This investment represents total profits for the investor of $10.2 million, or a 91% annual return, and an overall return on investment of 456%. Thank you for your time and consideration of the all-inclusive sports medicine facility known as Diamond Bone & Joint. If you have any questions, please feel free to ask.